Good morning, class.
Good morning.
My name is Mr. Carpenter. I'm going to be presenting to you today a lecture on the STI, sexually transmitted infection, known as syphilis. So moving on into the pathophysiology of syphilis, we have the spirochete bacteria. So syphilis is a bacterial infection. Spirochete is the type of bacteria. It is known as Treponemia palladium. That's just the name of the bacteria, with the spirochete being the type of shape that it comes in. And again, I've mentioned that it penetrates intact mucous membranes during intercourse, breaks in the skin, any kind of wound or anything like that, and then it goes into directly into the bloodstream and lymphatics after that. One of the interesting facts about this particular infection is from the time that you are infected, it takes an average of 21 days from the time of exposure until a primary lesion develops, which indicates, as I have on the board up here, your stage 1 primary stage where you have your genital lesions. Can range anywhere from 10 to 90, but it usually averages at 21 days, which would be about 3 weeks for you to be able to see that primary lesion. Moving on into the second stage, you have lesions on your hand and feet. You also have generalized symptoms, which could be sore throat, fever, patchy hair loss on the scalp or on the body, and then a fatigued feeling, which would be meaning that you would feel tired or sleepy pretty much all the time. These also can be systemic symptoms that can come before your presence of your primary lesion. So leading up to the presence of the primary lesion, you can experience any of these systemic symptoms, which mean they occur throughout your body, just not your primary lesion is localized, which means it's located in that one particular area. Fever, you're felt throughout your whole body. Your fatigued feeling, you're tired and sleepiness, you feel that throughout your whole body. So that kind of gives you an idea determining between systemic and localized symptoms. Moving from the stage 2, we have a latent phase, which that's where you don't show any signs or symptoms of the infection. It's known as the silent stage because you don't have any presence of any lesions. A lot of people think that, hey, my signs and my symptoms have gone away, my lesions have gone away, I don't feel bad, I don't feel tired, I don't feel fatigued, I'm cured. Not necessarily the case. You can still pass along that infection even though you're not symptomatic, not showing any physical manifestations or signs and symptoms of the infection. And again, when you see or experience any of these, you want to get that treatment going. Otherwise, you're going to go into the stage 4, which is known as tertiary. This infects the organs, internal organs, heart, lungs, bladder, even leading to death. But that doesn't come anywhere from 10 to 30 years at the time of your initial infection. So that just kind of gives you a general idea of a timeline of the syphilis infection, the different stages, and your signs and symptoms to look for syphilis itself. So I'm going to be passing out this handout here as we move on into the lecture here, going on into the risk factors of acquiring syphilis. So there's 4 risk factors that we're going to discuss when it comes to contracting syphilis. So you can contract syphilis having unprotected sex. You can contract syphilis from having multiple sex partners, a male having sexual relations with another male, or having a co-infection with HIV virus, meaning that you have the HIV virus. You guys learned previously that HIV suppresses the immune system, so that just causes your body to be more susceptible to acquiring other infections. So you're more easily can contract an infection such as syphilis if you already have HIV virus. The test that can be done for you to really know whether you have the virus, or a bacterial infection or not, there's 3 different blood tests that you can have done. If you notice that primary lesion or the multiple lesions in a genitalia area or oral cavity, you can have what's called an RPR, a rapid plasma reagent test. There's the Venereal Disease Research Laboratory test. It's known as the VDRL test. And then you have the toluidine red unheated serum test. And these tests are all looking at the presence of antibodies which are produced by your body to help fight infection. The more antibodies you have, the higher likelihood it is that you have presence of this type of bacteria in your body. And again, it's looking at your immunoglobulin M and G antibodies. And you guys will learn more about those antibodies further along in health education. So I'm not going to go too deeply into that beyond what we've already mentioned. So another neat fact about syphilis is it takes about 3 to 6 weeks from time of infection for the syphilis to show up in your blood. So let's just say, you have a suspicion based on the presence of these lesions that, hey, I might have syphilis, so I need to go get my blood tested to make sure that I have it or not. Well, if you are inside that 3 to 6 week window, that syphilis infection may not pick up or show according to the number of antibodies that show up in that blood, in any of those 3 blood tests. So you may end up having to go back again for another blood test, just if you still are experiencing any of these symptoms several weeks after that first blood test. You may have to go back and see whether or not those levels have went up since the last time you were checked with the blood tests. So moving on to the second topic of conversation here, and what I'm going to be talking about. So a person that's infected with primary syphilis, they're going to have, and we've already kind of touched base with the 4 stages here. So with your primary syphilis, you're going to have 1 or more sores at the site of infection. I have a visual model here of the external female and male genitalia. So you have an erect penis there, that's your male genitalia. You have a primary lesion at the base of the penis, and you have some secondary lesions that are around the shaft and the scrotum there. And then you have a primary lesion on the external genitalia of the female there. And then you have some other lesions as well. But your primary is going to be the larger lesion, and that's where the syphilis bacteria, the Treponema pallidum, entered into the body there of that particular lesion. So I'm going to pass this around. You guys can take a closer look at that, distinguishing between primary lesion and secondary lesions. Moving on into how to prevent contracting syphilis. So the number one important method of prevention of contracting a syphilis infection is abstinence from all types of sexual contact. So you have vaginal intercourse, anal intercourse, and oral intercourse. So you want to abstain from all forms of sexual intercourse. Can anybody tell me what it means to abstain? Just to make sure I know if you guys understand that word. Yes, ma'am.
Stay away from, but not have.
Very good. So abstain means to kind of choose not to engage in that type of behavior or activity. That's your number one way to prevent contraction. If the 2 individuals decide they want to engage in that behavior, activity, sexual activity, behavior, they can choose to use protection via a male or female condom or a dental dam. So I'm going to demonstrate how to apply a male condom and dental dam, and I'm going to have 2 students here follow along with me to make sure that they know how to apply a male condom and a dental dam. So I'm going to view. So we're going to open the condom. Banana here is going to represent an erect penis. You're going to take the condom, make sure the reservoir is out, the ring. It's important that the male penis is erect so that the condom will fit properly. And you're just going to kind of slide that condom down the shaft there. So now you have a barrier, a latex barrier in between the skin of the penis and the genitalia of the female there to prevent contraction of the syphilis bacteria. All right, moving on to the dental dam. You would open this condom. All right, you're going to take the tip and cut the tip off. And you're going to cut over the ring. So you'll take those scissors and cut. There you go. Cut the ring. And then you're going to spread this latex barrier out, and it's going to go over female genitalia, providing a latex barrier to prevent contraction, oral or external genitalia, whoever's got the infection, whether they have it in the oral cavity or they have it in the external female genitalia, to keep contracting the virus via either route. So you want to take that and just kind of go over. Very good. Very good. We'll have a question and answer session just to make sure that you guys have a good recollection of what we've talked about and can identify risk factors and signs and symptoms of syphilis. So, can anyone tell me by raising their hand what the 4 risk factors are for contracting syphilis? Yes, ma'am.
Having sex with another man, if you are a man, having an HIV infection already,
Right.
Having multiple sex partners, having unprotected sex.
Very good. Okay. If you suspect that you are infected with a syphilis infection, what are the 3 types of blood tests that you can have done to determine the presence of a syphilis infection? Yes, ma'am.
One of them was the VDLR or VDRL.
That would be the VRDL. Very good. Is there another one? VDRL, I'm sorry. So that would be the VDR, Venereal Disease Research Laboratory Test. There's another 3-letter test that goes along with the VDRL. RPR, very good. And then one that's a little bit harder to remember. It's not as well known as the toluidine red unheated serum test. All 3 of those tests kind of fall together. What are the signs and symptoms of a syphilis infection? Yes, ma'am.
Having a rash.
What stage would that indicate?
Oh, rash would be 2nd stage.
Very good. Very good. Any other signs and symptoms?
So lesions, genital lesions,
And
first
what?
stage 1.
Very good. Phase does not show any external symptoms. Anybody remember that stage?
The latent stage.
Very good. What are your 3 methods used for preventing the contraction of a syphilis infection? What's the number 1 important one? Yes, ma'am.
Not having
What's another one?
Condom,
Condoms. Very good. What is the 3rd one?
dental
That's all I have for today, for today's lecture on the bacterial infection known as, and the STI, sexually transmitted infection known as syphilis. Thank you guys for your attention. Have a great day.
Thank you.